Penis blisters are the type of thing a man notices reasonably quickly. Why? Because oftentimes, they are angry little buggers filled with pus and pain. Of course, when spotted, blisters on the penis can cause a lot of panic as they are often related to sexually transmitted infections, STIs. However, there are a few everyday, non-STI reasons for penis blisters, too. Let's take a look at these causes and treatment options, as well as ways to keep penis blisters from forming in the future. Penis blister causes. A host of things can cause penis blisters. Here are 7 of the most common. 1. Friction. When the skin is repeatedly or too energetically rubbed when dry, it can create friction, leading to blisters. Doing this with the penis, as in the case of dry intercourse or self-gratification, can cause blisters on the penis. To treat, simply keep the area clean and in the air as much as possible. 2. Folliculitis, commonly known as ingrown hairs. Folliculitis happens when hair follicles get infected and fill with pus. They will clear up on their own, however, shaving products, like Tend Skin, will help calm and prevent razor burn and the resulting ingrown hairs. 3. Genital warts, a type of STI. Genital warts are caused by human papillomavirus. They are generally itchy and look like little blisters, or sometimes they have a texture like cauliflower. Approximately 1% of all sexually active people in the United States have genital warts. When it comes to treatment, there are a few options for removal, which include freezing them off, laser surgery, or a prescription topical ointment to dissolve them. They are contagious for 2 weeks after removal, so be sure to refrain from any sexual activity during that time. A man can still spread the virus to his partners after this period, so be sure to use barrier protection when having relations. 4. Yeast infection. When naturally occurring candida yeast in the body overgrows, it can cause white penis blisters that swell, itch, and emit a chunky, white discharge. Yeast infections are contagious and can be passed between partners, so wait until it is cleared up before resuming sexual activity. See a doctor for treatment, which usually involves either a pill or a topical cream, or a combination of both. 5. Herpes. The herpes simplex virus, HSV, an STI, is one of the most common origins of penis blisters. Herpes is quite contagious and cannot be cured, but it can be controlled. Herpes blisters on the penis start off, but then eventually burst and crust over. Once they get crusty, they will itch like nobody's business and get red and angry. See a doctor or clinic immediately for treatment of the current outbreak and options for managing the condition. 6. Scabies. When the Sarcoptes scabiei mite tunnels into the skin, tiny, itchy blisters can form on the penis. These penis blisters will be most itchy at night when the mites are most active. Sometimes a man can have scabies for up to 6 weeks before he knows it. To treat scabies, see a doctor. Treatment will start with prescription creams and lotion, but if the infestation is persistent, oral medications will also be prescribed. 7. Syphilis. Bacteria cause this STI. Symptoms include rash, fever, hair loss, and swollen lymph glands in addition to blisters on the penis. Syphilis is a severe disease and should be caught as early as possible. If left untreated, it can result in blindness, loss of comprehension, and even death. Prevent penis blisters. There are a few common sense ways a man can avoid penis blisters from visiting his nether regions. The first is to practice safe sex. This means using condoms and barrier methods, and knowing a partner's status before engaging in relations of any kind. A man should also be sure to use enough lubricant when having sex with a partner or when pleasuring himself to avoid friction. A man should also employ good penis hygiene habits to keep the area supple and the skin healthy and pliable. Wash daily with a mild cleanser and warm water. Pat or air dry and then nourish the area with a specially formulated penis health oil. These oils calm the skin and keep the area clean and bacteria-free. Use an oil made of natural moisturizing bases like shea butter and vitamin E. This will keep the skin soft while fortifying it.